very, very excited to welcome to the stage Rachel Tornheim, the head of digital innovation at Mount Sinai, to talk a little bit about AI in care delivery.
So I'm Rachel Tornheim. I've been in the health tech innovation space for the last 14 years, both on the startup side as well as on the health system side. Something you may know about health systems is they tend to be very risk averse. So the first thing I wanted to share is a framework for thinking about AI applications in healthcare from a risk perspective. So 3 elements I'd like to discuss. First is, what is the type of task that the AI is helping with? So we've got a spectrum here. On the low end, the low risk side, we've got back office tasks. This is things like procurement, recruitment, or billing. So we've all seen some of the AI applications around prior authorization, that falls there. Next over, we've got front office. So a little bit more risky from a health system perspective because there is some interaction with patients, but still not involving care delivery. So this is things like scheduling or patient engagement and outreach. Next, higher risk is clinical care operations. So these are some of the administrative tasks that clinicians need to do as part of their care delivery processes. So some of the AI applications that fit in this bucket are the ones that will summarize a patient chart for a physician to review before a visit, or the ones that do the ambient AI listening during the visit and draft the note. And then finally, on the highest risk end in terms of the type of task AI is helping with is clinical care delivery. This is where we have the clinical decision support, doing things like risk stratification, suggesting diagnoses, or suggesting treatment options. So that's the task type. Next, we have the type of model. So here we've got 2 categories. The deterministic models, these are ones where for a given set of inputs, there is one output, and it's always going to be the same output because humans have built the models and designed the specific rules that determine how to translate inputs to outputs. So this is low risk, right? Because we know it's 100% predictable what's going to come out. The non-deterministic models, this is where all the attention has been lately, right? This is the machine learning and the Gen AI. And here it's riskier because we can't necessarily predict with certainty what's going to come out of the model. And there's a risk of hallucinations. Third factor is the level of oversight in the implementation or the way a tool is used. So you can imagine a scenario where we have a care delivery application, but you might have 100% oversight. So every time that tool is used, a physician is reviewing the results and deciding, are we going to go with the tool's recommendations or are we not? So that makes it low risk. You could also have partial oversight. So maybe if the tool has a very high degree of confidence, we say we don't need a doctor to look at it. But if it's not so confident, you want that oversight. And then you could imagine a model where we trust the tool so much that we don't have someone looking at the output at all. And in that case, obviously, that's going to be higher risk. It seems lately like AI is being thrown at every problem in healthcare. And so wanted to talk a little bit about what are the types of problems where it makes sense to use AI. For AI in general, we want to be looking at high volume tasks, right? Doesn't make sense to invest in building a model and implementing it to help with something we don't do very often. We also want to be looking at tasks where there's some reason it's not practical to just use humans, right? So maybe they're inefficient, maybe they're error prone, or maybe we don't have enough people with the right expertise to do that particular task. And then finally, we want to be looking at tasks that don't need a human touch. So I'm guessing, for example, most patients don't want to hear about a negative prognosis from a machine. They probably want to hear about that from a human. What types of tasks are good to address with deterministic models? Here, it's got to be a space that we understand really well as humans, right? So that we can code those rules that are going to drive the model's performance. Areas where precision is really important also make sense to address with deterministic models. If for a given set of inputs, you need one specific output and there's no potential variation from that that's going to be acceptable. And then finally, deterministic models really need structured data in order for them to work well. Now, on the non-deterministic side, these models can help to address spaces that we don't understand that well as humans, right? They can do the machine learning algorithms and they can figure out relationships that maybe we didn't know initially. These models are also good for areas where the data is unstructured, right? So either as an input or as an output, They can analyze images, for example, they can analyze paragraphs of text, and they can output those types of elements as well. So, what are some of the elements that are going to need to be in place for us to get to a place where we have broader adoption of some of these types of models that are seen as riskier? So, first is the technology. And here, I think the tech is pretty well advanced, right? We've seen a lot of really impressive AI tools that can, for example, mimic a call center employee in helping someone schedule an appointment, or analyze images of radiology or pathology reports and provide outputs that are higher accuracy than humans. So, the technology, I think, in many cases is there. Still room to advance, of course, but it's pretty far along. I think attitudes are kind of in the middle right now. So this encompasses both patients. I saw a survey recently of patients in the US that showed about a three-way split between people who think AI is going to improve healthcare, is going to reduce the quality, and is going to have no impact. And then I think attitudes among physicians and among hospital administrators are also kind of split, right? Some people are really excited, some people are quite cautious. I remember being at an A.Team event a few months ago where there was a question around this idea of pausing development of AI, and did people agree with that? Did they disagree? And there were folks in the room who were on both sides of that. And then the space where I think we're the farthest behind is governance. And this applies both within health systems. I think a lot of health systems are just now setting up some of those AI governance committees to try to lay some ground rules for how they're going to evaluate AI technologies and decide whether to move forward. And then there's also gaps in governance on the regulatory side. So I think there's a lot of open questions around things like liability, things like patient consent, and how we're going to handle those. So I think once we see more progress on the governance side, attitudes move a little farther along, I think we'll see broader adoption. Thank you.